going on, all of my healthcare brothers and sisters? I hope that y'all are having a wonderful day. Today I wanted to do a little bit of discussion regarding what emergency nursing is and if you think it would be right for you. So emergency nursing incorporates patient care from all ages and all specialties. This includes newborn with a fever, to delivering a baby, to providing life-saving measures to a patient in cardiac arrest. Yes, you may see all three of those things as an emergency nurse. This is never a guarantee of how our emergency nurse's day may go. It could vary from being very, very slow to being debauched with a whole bunch of different things, and you can't keep your head above water. If you enjoy having a fast-paced environment that's complex and chaotic, then emergency nursing is probably the career for you. However, in order to make it through a shift, you need to make sure that you have stamina. Stamina is huge. You need to be able to make sure that you're constantly on your feet. You're rarely ever going to sit down. Great coping skills. You're going to see a lot of death. You're going to see a lot of trauma. You're going to see a lot of people may not make it. And a lot of times that's very hard on people. So you need to know what your effective coping skills are. Ability to maintain a calm demeanor and think fast on your feet is huge in emergency nursing. Excellent multitasking skills, yeah, because you're going to be taking care of multiple patients with multiple different kinds of symptoms and diseases. And a good sense of humor. I always agree that emergency nurses kind of have a warped sense of humor because of the stuff that we deal with and the stuff that we see. So if you get in there and you're having a hard time with that kind of sense of humor, sometimes emergency nurses isn't for everybody because everybody deals and handles and copes in different ways. In my experience, I found many nurses that were not able to make it in the emergency department because they lacked a lot of these specific skills. So something I get asked a lot, how can I get a job in emergency department as a graduate nurse or an experienced nurse outside of the emergency department? So in my experience, many emergency nurses, or I should say emergency departments, are hiring nurses that are either new graduates or experienced nurses really outside of the specialty. Their training is just a little bit different depending on what you are. So if you're a new graduate coming into the emergency department, you're giving a longer period of training time compared to those with experience. Many places will provide emergency room simulation experiences and longer preceptorships to provide the individual person coming into the emergency department with more time to prepare them to care for patients independently. I want to make a note that you'll never fully be prepared in the emergency setting. Once your training is over, I remember when I came out of training, I was not prepared at all. And it was very scary because back then we took care of 4 to 5 patients and I was basically on my own. But in emergency, it's a very tight-knit group of people. I work in an open heart now, it's the same way, but it's a very tight-knit group of people that you can rely on and make sure everybody's got each other's backs. So emergency nurses are great in regarding to the teamwork aspect of it. So you get what you put out. So if you are very proactive with helping your fellow cohorts, they're going to give that back to you 9 times out of 10. Learning online classes and modules are usually provided for graduate nurses by a few facilities to give nurses a basic understanding of body systems and disease processes in case those things weren't covered in more detail in your nursing college. Some hospitals will provide actually a mentorship program, which is great, which will allow a new graduate nurse who is off training to follow somebody on their schedule, and it gives them an opportunity to ask questions without fear of being judged if they didn't know those questions. So that's something that was excellent that was provided to me when I was a graduate nurse. And the hospitals expect you to understand nursing basics once you complete their program. It's important that you know basic nursing in order to successfully graduate from the program. So for my experienced nurses, as an experienced nurse, you'll already understand basic nursing, patient care, and medication administration. Those things aren't going to really be covered to you again because you don't need to know those. You already know. This facility will provide these nurses with a shorter training period than those of the graduate nurse cohorts. And again, you're never fully going to be prepared when you come out of training, regardless if you have experience or not. I left emergency nursing, came back to emergency nursing, and when I came out of the orientation process, I still wasn't prepared. So it's something that you have to cope with and know that you've got teammates, they've got your back, you've got their backs, and everything's going to be okay. These nurses are not required to attend many of the simulation experiences because they probably already received these training experiences previously on the floors that they worked on, or it just might not be required. Modules and online classes are still provided usually to experienced nurses. However, many times these modules have been completed from previous experiences, working on the floor, those things. So just overall, the experience that an experienced nurse gets versus a graduate nurse is much less because you already have those skills and you've honed in on those skills. Another note as an emergency nurse, regardless of the experience you have, you need to know that you will never, ever know everything, and that's all right. I have witnessed too many times graduate nurses and experienced nurses coming in that, oh no, I already know this, I got this, don't worry about this. That is very, very dangerous in the emergency department. You know, you're not gonna know everything. If you know something specific because you worked on a floor such as a cardiovascular ICU and you know more about the heart than I do, I get that. Totally get that. But you don't know everything, and it's okay to ask questions and it's okay not to know everything. As a nurse, we have to possess a sense of humility and understanding, and it's all right, like I said, not to know everything. Sometimes we need to perform research or ask our lifeline, such as our fellow nurse or a doctor. It can be scary, really, to feel inadequate that you don't know these things or how to perform your job. As, you know, a community of nurses, we have to kind of stand together and help each other and build each other up as opposed to break each other down. So moving on, what do you need to become a new emergency nurse regardless of your experience? So certifications. It's all about them certifications. So basic life support, BLS, is very important. It's a certification you must obtain in order to provide basic life support measures, including cardiopulmonary resuscitation, CPR to both adults, children, and infants. This certification is required regardless of your specialty. It doesn't matter if you're working med-surg or psych or emergency. This is kind of the standard certification that you need to have throughout the hospital system. Advanced cardiac life support, or the ACLS, I have a video on that. If you want to watch it, feel free. I'll leave a link up here in the corner. It's an algorithm of medical procedures and techniques that are designed in the treatment of cardiac arrest, stroke, and cardiac emergencies in the adult patient. The course provides the user with skills such as defibrillation techniques, IV use, intubation, ECG analysis. Big thing that you'll need to know that a lot of people don't know is that you will never intubate a patient unless you are a physician or a respiratory therapist and have been specifically trained on intubation. So even though a lot of these courses cover intubation and those things, that's something that you're not going to physically do. Lastly, if you are working in an emergency department that takes care of both pediatric and adult patients, then you're going to get the pediatric cardiac advanced life support certification. That's your PALS. If you are working in an organization where you only see adults, 9 times out of 10, you probably won't need the certification because the pediatric areas will require it and you won't. But I maintain mine because if you decide to travel nurse or wherever you decide to go, it's important to have. PALS is a systemic approach to pediatric assessment that goes beyond basic life support measures used in children and adults, depending on the hospital, like I said, and the demographic you see. It may or may not be a requirement. And all of these certifications are renewed every 2 years through recertification classes. It's important that you attend those so that you can keep up with your skills. A lot of times American Heart Association or the governing bodies that hold these certifications will have new guidelines, and those new guidelines will be implemented, and you'll get those updated guidelines every 2 years when you renew. So lastly, what happens if you are a graduate nurse and you don't get the position in the emergency department? Some emergency departments, depending on what they are, a lot of like level 1 trauma centers, for example, don't usually hire graduate nurses into the emergency department. And that's okay. Nurses need to have a foundation of what it is that they need to know prior to going into the emergency department. I want to tell you, don't let it discourage you. It's not something that is looked poorly upon you. It's just requirements that certain emergency departments have. I want you to look at it as like an opportunity to work ahead, be smarter, and learn more skills. Working in, medical, surgical, progressive care, even intensive care, surgical step-down areas for 1 to 2 years prior to entering the emergency department provides irreplaceable experience. Coming into the emergency department is really hard, especially as a graduate nurse. It's extremely hard to come in as a graduate nurse because school teaches you book. School always teaches you book. And it just doesn't teach you the skills that you need to know in real life. I know that sounds sad. And even when you go on your clinicals and those things, you're going to start to see, you're like, oh God, it's very, very different than actually being a nurse versus learning to be a nurse. So you kind of have to accept the fact that as a graduate nurse, it's going to be extremely difficult, and you're going to have to work 5 times as hard as, say, an experienced nurse, because they already know the basics. They already know how to provide basic patient care. They're just learning the more critical aspect of emergency care, whereas you're learning the basics and you're learning how to provide that basic care, and you're having to learn the more critical aspects of emergency care within a shorter period of time. It can be very overwhelming and very scary. And that's why I always say, if you are a new nurse coming into the emergency department or an experienced, you're not going to know everything. You're not going to know. And that's why you have to rely on your team, and you have to build those trusting relationships with other emergency nurses. If you go in there and you're lazy and you don't do anything and you just don't, it's just a job to you, you're not going to make it in emergency nursing. And I think that's for any nursing profession that you go into. You've really got to put in what you expect to get out of it. So if you put in the work, you're going to get the same from your cohorts and your team members and the doctors and the physician, everybody. You're going to get that back. So I highly, highly, highly recommend that if you don't get into the emergency department on your first try, it's okay. It's okay to start on med-surg or PCU or ICU or step down to gain that basic experience, and then go back and apply to be in the emergency department. You know, knowledge is power. You gain knowledge in critical care areas that provide life and death resuscitation scenarios that will help you inevitably in the end if you decide that emergency nursing is the career that you want for you. I hope that this video was helpful for you in understanding what emergency nursing is and what's important about it, what's not important about it, what you need to do in order to get into it, and that it's okay that if you don't get into it the first time around, you can always apply again in the future. If you have any questions, please feel free to leave them down below. I love answering your questions. I love interacting with you all, and make sure that you follow me on my social media. I'm on Instagram and Facebook, where I post healthcare tips and certification exam questions to help you pass those certification exams. Until next time, I hope you all are having a wonderful day, and I will talk to you all again soon. Bye!